Hello. This quick, short, brief lecture series, I'm going to be talking about sexual health. These lectures I'm recording for my health psychology course, but they are also, of course, relevant for human sexuality courses that I've taught in the past, and certainly an area that I have been actively involved with in trying to develop, work with others to develop PrEP programs and talk about PrEP, which is a pre-exposure prophylaxis for HIV. But today, we're going to do the first part of these, which will be on bacterial and viral sexually transmitted infections. So this whole kind of brief series, this will be about 4, maybe 5 lectures. In this first sexual health lecture, I'll do an introduction to sexually transmitted infections. We'll talk about bacterial and a spirochete bacterial sexually transmitted infection, which is syphilis, and talk about a couple of the more common viral STIs. This isn't in any way a comprehensive list of sexually transmitted infections, but there's certainly ones that are primarily spread via sexual activity, and so we'll discuss those. In the next lecture, we'll talk entirely about HIV and AIDS, then talk a little bit about changing rates of sexually transmitted infections, and talk about both contraception and preventing infection. We're going to do some of that under HIV, AIDS as well. And then probably that will be the 4th lecture. And then the 5th one will round out with factors that increase the spread of STIs, impact of STIs, and then finally talking about sexual health as being not just about sexually transmitted infections, but about having a healthy sexual attitude and a healthy sex life. So let's get a move on with talking about sexually transmitted infections. First thing to understand is we use STI rather than STD, which is the traditional term, sexually transmitted disease, because it's a broader and more inclusive term. An STD only refers to a case where there is an infection causing symptoms. An infection, the important thing here, and it's a finite one, is infection and disease are two different but very related concepts. So you can have an infection that isn't causing any disease. And so that's kind of where we have to think about it. In fact, most of us are infected with a lot of bacteria and other viruses that aren't causing any disease whatsoever. And when we talk about HIV, we'll talk about how some of those diseases can rear their heads due to suppressed immune systems. But infection is how things get spread. So, first thing to understand is there are at least about 19 million new cases per year estimated in the United States, so quite a bit. Fortunately, with very few exceptions, most of these are relatively benign, but certainly something you want to get treated for because they can cause very serious infections in some people, and a few of these can be fatal if untreated. And of course, rates of sexually transmitted infections vary throughout the world. To give you some idea about the United States, young people are the most likely to be infected and are the most commonly diagnosed cases. So I believe this is 15 to 24-year-olds, make up about 27% of the population, but about half of the 2 million new STIs in the U.S. each year, or 20 million, sorry. And this all comes from the CDC. 70% of gonorrhea infections are those under 24. 63% of chlamydia cases, 49% of HPV cases, 45% of new genital herpes cases, 26% of HIV infections, and we'll talk about HIV later, and then 20% for syphilis infections. One of the things with HIV is there's a cumulative lifetime risk for HIV because all of these you can, except for HPV, you have virus that, of course, you'll keep forever, like herpes as well. But for bacterial infections, you can keep getting reinfected with those. So lifetime risks for HIV is something we talk quite a bit about. And there's a sort of cumulative lifetime risk. A lot of people don't know that they have any of these sexually transmitted infections. So when we look at estimated total new infections versus diagnosed and reported cases, certainly less than half, I would say about half or less than half of chlamydia cases are diagnosed and reported. Chlamydia oftentimes displays no symptoms in either males or females. Very rarely are there any symptoms at all in males. Gonorrhea is a little bit more obvious in its presentation for most people, and we'll get into that here in a moment. But the biggest thing is you want to make sure that if you are having frequent sex with really anyone, that you're all getting tested. You think about what kind of ways to reduce your risky behaviors, that you get the Gardasil vaccines to get vaccinated against HPV, because there are a lot of risks associated with HPV. But much like everything we're talking about here in 2020 with COVID-19, it's about getting tested and reducing our risk behaviors. It's the exact same thing with sexually transmitted infections as it is with COVID-19. Fortunately, going to the grocery store is not a risk for any of these STIs, so that makes it a lot different. To give you an idea about how these are distributed across the world, Africa and North and South America have about the same prevalence of sexually transmitted infections. If you look at Southeast Asia and the Mediterranean region, they apparently have the lowest rates of reported infections. And again, this is where we start to get in terms of questions about reported infections. And then Europe, about 5.5% of reported infections. And I would say the data in Europe is pretty good because most of Europe has healthcare available for everyone. And so I would say testing is probably at a premium there. But there are probably also some socio-cultural differences as well. So that gets us into thinking about what these specific infections might be. We'll start with chlamydia. Chlamydia is the most prevalent bacterial sexually transmitted infection. We have a saying in the sexual health arena, pretty much everyone's had it, everyone's going to get it, particularly those of you who might be anywhere under the age of 30 at this point. First thing to know is that all bacterial infections can be transmitted via any oral, anal, or vaginal sex routes. We're not going to get these from any sort of manual, masturbation, mutual masturbation, that sort of thing. But anything involving penetration or the type of sex involving the kind of mucous membranes of the mouth, vagina, and the anus certainly can be transmitted that way. These can, of course, be cured by antibiotics. Symptoms are often minimal, and people may not know they're infected, and oftentimes their chlamydia is treated when they go to the doctor and get antibiotics for something else. So that's something to keep in mind. If you had a course of something like doxycycline, you might have had chlamydia and had it treated. Certainly doxycycline is what treats syphilis, which we'll talk about here in a moment. Importantly, for women, if left untreated, this can develop into pelvic inflammatory disease and potentially cause infertility. And so part of your regular regimen of healthcare should be getting tested for chlamydia. It's primarily tested for in a urine sample and UA. It's painless, simple, and certainly something that you should be doing on a regular basis if you're sexually active because of that pelvic inflammatory disease. To give you an idea about how prevalent chlamydia is and where, these are cases per 100,000 people. So you can see West Virginia has very low rates of chlamydia. Again, these are diagnosed cases. Got to keep that in mind too. You'll start to see that a lot of STIs are endemic across the South and oftentimes in areas where a lot of rural poor, but also throughout the Bible Belt. And those who have taken my human sexuality class in the past know there is a lot of interesting scholarship on the correlations between evangelical Christianity and sexual behavior and attitudes about sex. So, just to give you an idea where it's most prevalent, if you do this by county, no surprise, most often highest prevalence tend to be in urban areas, college towns. I'm looking at Colorado here. So that's not really surprising at all throughout the South. Really endemic throughout the South and in a number of other poorer communities. Again, probably because these are where people aren't getting much health care to begin with. So it's always something we have to keep in mind. So in terms of age range and sex, women are certainly primarily at risk for chlamydia and 4 more likely to be diagnosed. Again, primarily often because men do not show any symptoms, and so oftentimes are undiagnosed. So the rates are probably genuinely fairly equivalent across these groups, with very high rates in women aged 20 to 24, really 15 to 29, incredibly high rates overall. Gonorrhea is the next significant bacterial infection. Symptoms here generally present in a more obvious fashion. They consist of a yellow or bloody discharge from the vagina or discharge of a thick pus from the urethra in males. It's fairly unpleasant. It used to be called the clap or the drip. I don't know if you watch any 60s, 70s era movies, they always talk about being the clap. The initial infection, however, may be asymptomatic. So people may be carriers, but not aware that they have an infection. This can be, of course, contracted the same way by vaginal, anal, or oral sex with an infected person. Rates have dropped dramatically since the 70s, again, because of improvements in testing and treatment with antibiotics. But it does remain one of the most common bacterial STIs. As I said, it's treated with antibiotics, but we are seeing bacteria-resistant strains crop up in a couple of places, and so that's concerning. This is usually treated with penicillin or Rocephin, I think is the other injectable antibiotic. The most unpleasant part about this is going to be that shot. Anybody who's had a Rocephin or penicillin shot know that it's very uncomfortable. Fortunately, the test for this is now primarily done in a UA. It used to involve for males in particular, this was unpleasant in that it involved a swab of the urethra. I'll let you all figure out what that's going to be like. I can tell you it's very unpleasant. So, much lower rates than we saw with chlamydia, but certainly still around. Very similar distribution of cases as we saw before. Again, pretty similar to what we saw, but just much, much lower rates than we saw with chlamydia. Chlamydia is just endemic and virulent, and it's basically just everywhere. In terms of who's at most risk, similar situation here. Here we see males are a little bit more likely to be diagnosed. It's probably not very significant. And a couple of age ranges here, continuing onward. So much greater risk sort of overall once they reach age 20. Certainly, this is probably closer to what the chlamydia rates might be if we were getting significant testing across the board. But again, gonorrhea is much more likely to be symptomatic in males, and so that's why we're getting better diagnostic numbers. Also, across these age ranges, there is potential for males to be having more sexual partners in some instances, but I don't know. There's some of the data behind that is mixed, so it's a questionable conclusion, but something to think about. Finally, we get to syphilis. We're going to spend a bit of time on this because there's a lot to deal with here. This is a really important infection because this is on the list of potentially fatal sexually transmitted infections. It's caused by infection with a corkscrew-shaped bacterium, or it's called a spirochete. If untreated for a long time, it can be fatal. Importantly, syphilis causes breaks in the skin and greatly facilitates the transmission of HIV. So we often see outbreaks co-occurring with syphilis and HIV. Again, rates have dropped dramatically over the years, but there's been a recent uptick in cases among men who have sex with men. In fact, all the STIs have gone up in the recent years. I'm going to talk about that a couple lectures from now. So it's certainly something we have to be mindful of. One thing we're seeing there being some push for, particularly among people who are high risk, men who have sex with men, or men or women who have high risk lifestyles, prostitutes, etc. Other sex workers might be potentially interested in taking doxycycline as a preventative measure, so they basically stay on doxycycline to sort of constantly treat any potential infection. There is some fear, of course, about bacterial resistance, but as long as those levels are high enough in those patients, it seems to work pretty well. There certainly has been some call in the literature for doing a course of doxycycline once a year fairly frequently for people who are at risk. but that's something to talk over with your doctor. So we call that pre-exposure prophylaxis, and we're going to see that again when we talk about HIV. So this is what this thing looks like. It doesn't look like any normal bacteria. That's why they call it this kind of weird spirochete. Those of you might have taken any kind of health class or sex ed class in your earlier years. It used to be that what we would like to do is show you what these chancres look like. They're not that common, and so I don't show them, one, because they're disturbing and gross, and I don't want to look at that either. But also, not very many people show these chancres. So they might be visible on the penis or the labia, but they might be hidden inside the vagina or cervix, or other sort of internal body parts or inside the mouth. So somebody might have a sore inside their mouth. But because it's a break in the skin, it greatly facilitates the potential transmission of HIV. Breaks in the skin are the way in which HIV has its access to the body. So it comes out through sperm and semen, primarily, and then gets transmitted into people's bloodstreams by breaks in the skin, based on the type of sex they might be having, or of course, needle sharing or blood transfusion, but that's very rare these days due to better testing. So basically, syphilis has about 4 stages. We call them, there's really 3 stages, but it does enter this sort of weird latent stage. But primary syphilis is the initial infection. The bacteria penetrate the skin and multiply, can produce a chancre in the newly infected person, doesn't always. Secondary syphilis, the infection tends to lead to flu-like symptoms with a painless rash, typically on the palms and soles of the feet. Then it enters this latent phase where symptoms are gone, but the spirochetes continue to multiply. And then there's sort of this overall latent phase. Then when we get into tertiary syphilis, and here's the kicker. Syphilis is treatable up until the tertiary syphilis stage. Once you're at the tertiary syphilis stage, it's no longer treatable with antibiotics. So any time prior to this, it's easily treatable with antibiotics. But tertiary syphilis is pretty ugly. This is how Al Capone died. This is, of course, part of the very infamous Tuskegee syphilis studies, in which the disease was allowed to run its course through a group of low-income African-American males. And so while those men could have been treated at any time, they were not. And so I urge you to look into that, because it's a horrible part of our history, but a lot of what we know comes from that unfortunate study. So large ulcers may appear on the skin or internal organs. Heart, central nervous system, or the skeleton are potentially affected. Oftentimes, tertiary syphilis results in an encephalitis-like disease, and people go quite mad. And it's a pretty ugly way to go. So get tested and get treated. So if we look in 2016 of reported cases by sexual behavior, you can see that there's a pretty significant spike in primary and secondary syphilis in men who have sex with men. Primarily, this is an interesting difference between syphilis and HIV, which we'll talk about in the next lecture, is whites are the most likely to be diagnosed with in new cases of syphilis. So the incidence of syphilis seems to be higher in white males who have sex with males, but HIV is actually higher in both blacks and Hispanics. So we'll unpack that a little here in the next lecture, but there are some reasons for that. Where is it most prevalent? Well, the Wild Wild West is where it seems to be occurring at its highest rates, followed by the South, the Northeast, and finally the Midwest. Wherever you live, however, you should be getting tested and monitoring for that. So you can see the biggest thing here is there has been a pretty dramatic increase in cases since the early 2000s, coming here into the 2010s. I guess we're now in the 20s, sorry. So if we look at these in terms of rates, much lower again, very low rates of infection, but because of its seriousness, we want to make sure we're keeping an eye on this. Florida and California, pretty high rates. These tend to be outbreaks too amongst sort of specific communities, and so keep that in mind. If we look at county by county data, looks pretty much like what we've seen in the past. Urban centers being obviously an important part of this, etc. All right, so those are the bacterial infections, imminently treatable with antibiotics, but now we're into the viral STIs, and the STIs we're about to talk about don't have really much treatment at all. Herpes does have drugs to control its symptoms, but HPV, which is human papillomavirus, is the most common viral STI. It's spread via sexual activity and skin-to-skin contact, and importantly, can be transmitted even if you're using condoms. This is why I urge you to get your HPV vaccines. And depending on your age, it's very easy to get those. If you're a little bit older, like I am, there's some question about whether or not it's efficacious in terms of people might already be infected with some strains. But some of these strains of HPV can cause genital warts. Others are linked to cancers of the cervix, anus, and throat. And I know more than one male who has had cancers associated with this particular disease. Certainly plenty of women who had cervical cancer. And so this is preventable. And I highly recommend that you get this vaccine if you have not. It's safe. There's all kinds of reasons to do so. So I highly recommend it. Herpes is the other major viral STI. Herpes is part of what's called the varicella zoster viruses. So it's fairly closely related to chickenpox. Is the herpes zoster virus versus the varicella zoster virus, which is chickenpox. So HSV1 is associated with the mouth. HSV2 is associated with the genitals. It's highly contagious, generally easily spread through sexual activity, skin-to-skin contact, and kissing. One of the few of these that are associated with lower risk activities like kissing. Condoms do not provide full protection. Symptom severity and frequency varies across persons, and people are most contagious when they're having an outbreak. And so this is one of those things that is generally well managed through some antiviral medications, can manage those outbreaks. And so certainly well treated individuals who are good at managing their outbreaks are certainly doing well and will be less infectious. This is another one of those diseases that a lot of people have but don't know that they have. And so that's one of those things to keep in mind. All right, well, we're going to pick up with HIV and AIDS in the next lecture, and we will talk with that very soon. Please have a great day. Stay safe out there.